friends. I am Dr. Pavan Kumar, consultant cardiac surgeon. Today we share some information about a procedure called endarterectomy procedure in coronary artery bypass surgery. Coronary endarterectomy procedure by definition is a procedure of removal of atheroscleromatous plaque, and the core of the plaque is dissected out to restore the normal sized lumen in the coronary arteries. Now, what is the benefit of this procedure? Endarterectomy procedure is beneficial, very useful in achieving complete coronary revascularization. In patients with the diffuse coronary artery disease, particularly the distal portion of the coronary artery is blocked or has a disease in there, and if we put in such situation, if we put a graft, that graft either will fail or will supply reduced amount of blood flow as it was required from that graft. So they are most likely to fail. That is why we have to core out the internal lumina or the intima of the media to make completely patent lumen in the coronary arteries. To do that, we require this procedure called as coronary endarterectomy procedure. Now, what is the incidence of this procedure? Normally, we don't do this procedure very often. In international literature, the incidence is between 4% to 5% of all coronary artery bypass surgeries. In my experience of over 32 years in Mumbai, where I have done around 12,000 coronary artery bypass surgeries, I have done around 800 coronary endarterectomy procedures in different vessels of the coronaries. The left anterior descending artery was the most common, then the right coronary artery and the posterior descending artery, and then less often in circumflex artery. Many of the times in many of the patients I have to do double vessel endarterectomy, or in some cases I have done triple vessel coronary endarterectomy procedure. Now, if you think that why do we require this procedure? What are the indications of coronary endarterectomy procedure? The indications are diffusely diseased coronary artery, as I told you about earlier, or there are multiple blocks throughout the length of the coronary artery, or the vessel is totally occluded. Like a person who suffers a heart attack, usually coronary artery may get occluded. So if the whole coronary artery is totally blocked, and we know that in this area of the heart, muscle is still viable by doing PET-CT or thallium scanning, and then we have to restore blood supply in this area also. So if vessel is totally occluded, we have to do this procedure to make a lumen available where we can put the graft. And lastly, if there is a calcific plaque at the site of anastomosis, while we are doing a coronary artery bypass surgery and there is a calcific plaque, we cannot put sutures throughout that calcific plaque, so we have to remove calcific plaque, what we call we to do endarterectomy procedure. Now, procedure is very simple. How do we do this procedure? Either we do cut open the full length of the coronary artery, what we call as open endarterectomy procedure, and throughout the length we put a vein graft or internal memory artery throughout the length of the coronary artery, or we do a small incision, what we call a closed endarterectomy incision, and through that small incision we core out the intima and the media distal to that incision in the coronary artery and proximal to that incision of that coronary artery. And at that incision we put a graft. Either we put a vein patch and on which the internal memory artery is anastomosed, or direct internal memory artery can be put on that incision and restore the blood supply in that newly cleaned up lumen of that coronary artery. So these are the things which we do in this procedure. This procedure has to be done very gently. We using traction and counter traction with the special equipments we use to core out clearly with the branches and the septals of the coronary artery, and full length has to be taken out and restore the normal lumen. That is how we take out. We see in this picture the whole length of the right coronary artery and the PDA has been taken out, so that lumen is patent till the end of the coronary artery. Similarly, if you see on the left anterior descending artery, in this specimen, you take out the full LAD as long as the blocks are there. All blocks are removed, and then we put a graft on that, so that graft flows, blood flow through the graft is very good. Now, what are the grafts used in this procedure? Normally, if there is a open endarterectomy procedure, then we put a saphenous vein patch or saphenous vein graft. On the top of it, we can use internal memory artery or arterial grafting. Grafts are used according to the need of the situation. Now, what are the dangers in this endarterectomy procedure? There are dangers if you don't do it properly. If there is an incomplete endarterectomy procedure, the ends are not tapered well, so that there may be obstruction beyond, and the graft flow will be limited, and then patient may suffer a heart attack, or graft will fail, or person will have a lot of arrhythmias after the operation, and it may have impression or impact on the heart function. Low cardiac output and ejection fraction may fall, and it can have a mortality also. It has a higher mortality if it is not done properly. If done properly, diligently, with expertise, with all the equipments at your command, and take out the full length of the blocked vessel and restore the lumen properly, then it is safe as a normal coronary artery bypass surgery. Long-term results and the success depends upon the expertise and skills by which we carry out this procedure. Usually depends upon the core risk factors like diabetes, high diabetes, calcification of the coronary arteries, multiple endarterectomies together, or age of the patient, where vessels are calcified, so that we have incomplete revascularization. So these are the certain factors which affect the long-term success. If done right, it has given a very good long-term result to me, and success is as equal to a normal coronary artery bypass surgery. Now, I wish to present to you or share with you experience of this patient which I operated last week. If you see here the angiography of this patient, left anterior descending artery is diffusely diseased right from proximal to mid-third to distal LAD. There are multiple blocks, and because of he has high diabetes and he's hypertensive, although his age is 62 years. So no way I could put a graft in this vessel, because blocks are diffusely diseased. It will have a high graft failure rate. So I made a close small endarterectomy incision in the between mid-third to distal third of the left anterior descending artery, and poured out this media and intima, the atheroscleromatous plaque from the LAD. You see here almost a 6 centimeter long the plaque I removed. That is where the fullness of the procedure was carried out with the expertise and the dedicated equipments. And here you see the postoperative ECG of this patient. ECG is normal. So that is the beauty of this procedure. If done right, patient gets a very good benefit, excellent long-term results. So important point is that endarterectomy procedure should be done when required. And not many surgeons we do, because they think that this procedure has a certain amount of risks involved with the postoperative complications. But if you have expertise, and if you have experience, and if you have adequate right specific equipments, you can do this procedure safely, because it is very important to provide blood supply to all the areas of the myocardium. Whether if it is a totally occluded coronary arteries or it's a diffusely diseased, you shouldn't leave diseased vessel. You must provide complete revascularization of the myocardium, even if it is the coronary arteries are diffusely diseased. That's the aim of the successful coronary artery bypass surgery. Thank you very much.